Hi, once again welcome back to Obstetrics and Gynecology for All. In the previous video about fertilization, we have seen about the fertilization, development of the fertilized embryo, and we have seen how the placenta is getting developed, fetal membranes, amniotic cavity, everything is getting developed. So today we are going to see about these structures, that is amniotic cavity, amnion, fetal membranes, about amniotic fluid, and about the umbilical cord also. So first let us see about the fetal membranes. The fetal membranes are amnion and chorion. Already we have seen it in the video about the fertilization. This amnion is the inner layer of the fetal membrane. See, we know that the fetus is lying inside a watery medium. That watery medium is known as the amniotic fluid, and this watery medium is covered by two layers. That two layers are amnion and chorion. In that, amnion is the inner layer or the layer which is coming close to the amniotic cavity. Okay, and it's having a smooth shiny appearance, and it is made up of connective tissue, and the thickness of amnion is 0.02 to 0.5 millimeter. And the layers of the amnion, if you are looking from inner to out, first it contains a single layer of cuboidal epithelium, then above that basement membrane is there, then a compact layer of reticular tissue is there, then it is followed by a fibroblastic layer and a spongy layer. So these 5 layers are there for the amnion. And this amnion, if you are looking, it's not having blood supply, nerve supply or lymphatic supply. So these are the main points about the amnion. Now let us see about the chorion. It is thicker than amnion, but still it is fragile and shaggy on both ends. Internally it is attached to the amnion, and outside it is covered by tropoblastic layer of the decidua capsularis and decidua parietalis. And if you are having any doubt about the decidua capsularis and decidua parietalis, you please see the video about the fertilization. So the inner side of the chorion is amnion, and the outer side is the layers of decidua, that is decidua capsularis and decidua parietalis, that is it is in contact with the uterine endometrium. And this chorion is also not having blood vessels and nerves. Next, functions of these fetal membranes. These fetal membranes contribute to the formation of amniotic fluid. To a certain extent, this is also forming the amniotic fluid, and it prevents the ascending uterine infection. That is, this membrane is covering the entire fetus and the uterine cavity, lining the uterine cavity, and it prevents the entry of infection on microorganisms from the vagina or from the outside of the body. And during the time of labor, this fetal membrane, this fetal membranes, inside the fetal membranes, amniotic fluid is there. So this fluid filled membrane will come and get applied or come and hit on the cervix. See, it's like a balloon. Inside the balloon, if you are filling the fluid, how it will be, the same appearance will be there. Inside the amnion and chorion, amniotic fluid is there. So this membranes with amniotic fluid will come and hit over the cervix. We know that during pregnancy the cervix is closed, and when this amnion when the amnion is coming and hitting due to the uterine contractions, it will help for the dilatation of the cervix. And during delivery, we know that the cervix should dilate, and from 0 centimeter it should dilate up to 10 centimeter. So this bag of membranes, this amnion and chorion with the fluid, helps for the cervical dilatation. And another function is it produces prostaglandin. Prostaglandin is a hormone which is helping for the effacement and dilatation of the cervix. That is, I told you about the cervical dilatation. So it is a hormone which is helping for the dilatation of the cervix, and at the same time it helps for the contractions of the uterus also. It's having two functions. So these fetal membranes produce this prostaglandin, and it helps for the contraction and dilatation of the uterus and dilatation of the cervix during the time of delivery. So these are the important functions of the fetal membrane. So we have seen about the structure, layers and functions of fetal membranes. Already we have seen about the fetal membranes, that is amnion and chorion. Now let us see about the amniotic cavity. See, this amnion and chorion inside is covering the fetus and their fetus, and it is lining the uterine endometrium also. Inside this membrane, a fluid is there. That fluid is the amniotic fluid, and that entire cavity is the amniotic cavity. Initially, in the initial stage of fetal development, this amniotic cavity will be there only over the dorsal side of the embryonic disc. For the clarification, you please see the video about the fertilization. Embryonic disc and the amniogenic cells and amniotic cavity, you can see very clearly in that video. So this embryonic disc, it is present over the dorsal side of the embryonic disc in the initial stage of fetal development. Later, it will grow and it will start to cover the entire fetus. So when the pregnancy is progressing, the complete fetus will be lying inside this cavity with this fluid medium. So inside the uterine, inside the amniotic fluid. So now let us see about the amniotic fluid. The sources of production of amniotic fluid, already we have seen it is producing from the little amount is getting produced from the fetal membranes, and balance is from the transudates of maternal serum, transudates from the umbilical cord, fetal skin, and fetus pass 400 to 1200 ml of urine per day. Per day it passes 400 ml to 1200 ml of urine. And from that to 1200 ml, it swallows around 200 to 500 ml at term. Daily, the baby will be swallowing 200 to 500 ml. So the balance amount also will be contributing to the amniotic fluid. Then about the amount of amniotic fluid, see the amount varies according to the gestational age, according to the weeks of pregnancy. So initially, already I told you that initially the amniotic cavity is present only at the dorsal end of the embryonic disc. That is, it's a small cavity. So the amount of fluid also will be less. When the pregnancy is getting advanced or when it is progressing, the amniotic cavity will cover the entire fetus and the full fetus will be inside this amniotic fluid. So the amount of fluid also will increase. At 12th week, if you are assessing the amniotic fluid, amount of amniotic fluid, it will be around 50 ml, and at 20th week it will be around 400 ml. At between 36 to 38 weeks, it will be around 1 liter, and after that up to 43 weeks, reduction of 200 ml will occur. That is, after 38 week, if the pregnancy is progressing, the amount of amniotic fluid will start to decrease. Up to 36 to 38 week, it will be increasing and it will come up to 1 liter. After 36 to 38 weeks, it will start to decrease. Okay, that's all about the amount of amniotic fluid. And if you are looking into the physical features of the amniotic fluid, it is alkaline in nature and its specific gravity is 1.010 and the osmolarity is 250 milliosmol per liter, and it suggests, if it is 250, it suggests the fetal maturity. So this osmolarity 250 you can see at the term, that is at 36 week, you can see this osmolarity. So by assessing the osmolarity of the amniotic fluid, you can assess the fetal maturity also. Next, color of the amniotic fluid. Initially it is colorless, but near to the term it will become pale colored. And if abnormal colors are there, if it is not pale or if it is not colorless, if and any other colors are there, means it indicates different conditions. So now let us see what are those. If it is green in color, dark green in color, it shows that it is meconium stained. Meconium means it's a first fecal matter which will be passed by the baby. So usually the baby will be passing this after the delivery of the baby. But in the case of fetal distress, that is, if the baby is struggling for the oxygen from the uterus, that is fetal distress, fetal heart rate will increase. So the baby will involuntarily pass the meconium from the uterus itself. So when the baby is passing this meconium or stool, it is green in color and it will enter into the baby is passing into the amniotic cavity only. So the amniotic fluid will become green in color. So if meconium stained amniotic fluid is there, means it indicates fetal distress. That is, green color amniotic fluid is there, means it shows meconium, the baby has passed the meconium and it indicates the fetal distress. And if golden color amniotic fluid is there, means it is due to the destruction of RBC and it suggests the RH incompatibility of the mother. And if the amniotic fluid is saffron, that is greenish yellow, it shows the post maturity. Post maturity means that the pregnancy will be continuing after 40th week. We know the normal duration of pregnancy is 280 days or it is 40 weeks. And if it is continuing beyond 40th week, that is known as post maturity. In that case, the color of the amniotic fluid will become saffron. And dark colored amniotic fluid, if it is there, means it shows the accidental hemorrhage, and if it is chocolate colored, it shows the intrauterine death. It shows the death of the baby. If you are looking into the contents of amniotic fluid, 98 to 99% is water only, and 1 to 2% solids are there in the amniotic fluid, and it includes organic solids and inorganic solids. In the organic solid, 0.3% of protein is there, 20 milligram of glucose is there, 30 milligram of urea, 4 milligram of uric acid, 2 milligram of creatinine, and 50 milligram of total lipids are there. And inorganic solids include sodium, chloride, potassium, and the level will be almost same as like the level of maternal blood. And along with this, it contains the suspended particles, that is lanugo, remnants of fetal skin, and vernix caseosa. Vernix caseosa is a gelatinous substance which is covering the baby, and fetal skin, you know that shedding of the skin will be there throughout the life. So fetus also will be shedding the skin, and this skin will enter into the amniotic fluid. Lanugo is fine hair-like structures over the body of the baby, and when the baby is shedding this lanugo, that also will be there in the amniotic fluid. So that's all about the contents of amniotic fluid. Now let us see the functions of amniotic fluid. During pregnancy, it's having the function of protection. That is, already I told you that it prevents the invasion of microorganisms from the lower genital tract, and it gives protection against the invasion of microorganisms. That is one thing. And another thing, if you are applying pressure over the abdomen, this fluid inside the uterine cavity will equalize the pressure, and it will prevent the damage for the baby. And next function is maintenance of temperature. The fluid will be maintaining a normal temperature, a stable temperature inside the uterine cavity, and it allows free movement of the baby. In a watery medium, it is free for the baby to move, and it prevents the adhesions of the fetal parts, and it gives water for the baby. Already we have seen the baby will be swallowing 200 to 500 ml of amniotic fluid per day. That also is a function. And next, during the labor, it helps in the dilatation of the cervix. That we have seen already, that hydrostatic pressure from the fluid filled cavity will be applied over the cervix of the uterus, and that helps for the dilatation of the cervix. And another one, during the time of uterine contractions. See, during the time of labor, the uterus will be contracting to push the baby outside the uterus. So when the uterus is contracting, the size of the uterus will be decreasing, and it may apply pressure over the placenta. And if pressure is getting applied over the placenta, it will get compressed, and the circulation to the baby may decrease. So if the circulation to the baby is decreasing, baby will not get adequate amount of oxygen. So there is a chance for fetal distress. But when it is inside the fluid medium, here we know that the placenta, umbilical cord, everything is inside the fluid medium. So when pressure is getting applied inside the uterine cavity, it will be equalized to all parts, and placental compression can be reduced to a certain extent, so that we can prevent the fetal asphyxia and fetal distress. Next, during the time of labor, when the uterus is contracting vigorously towards the end of the first stage of labor or in the beginning of the first stage of labor, stages of labor I will be teaching you later. You just think in the beginning of the labor, this fluid filled cavity, it's a fragile membrane actually, amnion and chorion, that already I told you. So this fragile membrane, when the uterus is contracting, it will break. And when it is breaking, what will happen? The amniotic fluid will leak out of the uterus. So it will be coming through the cervix, vagina, and it will go to outside. So when it is coming through the cervix and vagina, it will just flush the birth canal, or it will clean the cervix and vagina, and it prevents and protects the ascending infection. So if some microorganisms are there in the cervix or vagina, it will be just cleaned by this fluid when it is flowing through that cervix and vagina. And the clinical importance include it helps for identifying the fetal maturity. Already I told you about the osmolarity will be 250 at term, and if it is 250 you can ensure that the fetal maturity is there. And if you want to induce abortion, that is in the earlier pregnancy, if you want to induce abortion directly into the amniotic fluid, you can instill drugs, you can inject drugs into the amniotic fluid, and it helps for the abortion. And amniotic fluid index, that is AFI, amniotic fluid index, is used to assess the polyhydramnios and oligohydramnios. Polyhydramnios means it is excessive amount of amniotic fluid. See, in a term I told you that the amniotic fluid amount will be 1 liter, and if it is more than 1 liter, it is polyhydramnia, and if it is less, that is known as oligohydramnia. The amount is less. So this AFI, amniotic fluid volume index, if you are assessing, you can identify whether polyhydramnios and or oligohydramnios are there or not. How to assess this AFI means you can just divide the abdomen into 4 quadrants, 4 regions. You can just divide it, and from each quadrant you just measure the largest vertical pocket, largest length in each vertical pocket. Vertically you just take the measurement in each pocket and add the measurements of these 4 quadrants and see how much you are getting. And if this measurement is if it should be normal, it should be between 5 to 25 centimeter. If it is between, if the amniotic fluid index is between 5 to 25 centimeter, it is normal. If it is more than 25 centimeter, it indicates polyhydramnios. If it is less than 5, it indicates oligohydramnios. And another function is rupture of the fetal membrane is helpful for the induction of the labor. See, when you are performing artificial rupture of the membrane, artificially also you can rupture this membrane during the process of labor. Naturally it will get rupture, but in order to accelerate the labor process or in order to induce the process of labor, you can rupture the membrane. When the membranes are rupturing, what is happening means, already I told you that these membranes, amnion and chorion fetal membranes, produce a hormone known as prostaglandin, that already we have seen. And I told you that the function of this prostaglandin is it is producing uterine contraction and dilatation of the cervix. And when you are rupturing the membrane, you are just irritating the membrane. So this irritation, what will happen, it will stimulate this membrane, and this membranes will start to produce prostaglandin due to that stimulation, and it helps for the induction of the labor, because when it is getting stimulated, it will produce more amount of prostaglandin, and when more amount of prostaglandin is producing, the uterine contractions will become more, and it helps for the dilatation of the cervix also. Next, we can see about the umbilical cord. It is also formed by the fetal membranes, that is amnion and chorion, and the normal length of the umbilical cord is 50 to 53 centimeter. Thickness of the cord is 2 centimeter, and the outer surface is covered by the amniotic membrane, and the bulk of the cord is due to the presence of a jelly-like substance, Wharton's jelly, and it prevents pressure on the umbilical arteries and vein. And if you are taking the umbilical cord, there will be 2 arteries and 1 vein. 2 arteries and 1 vein will be there. This is the structure of the umbilical cord. See, this is a cross section of the umbilical cord. This is placental artery. 2 placental arteries are there. This is placental vein, and this Wharton's jelly is covering the entire thing. And arteries of the umbilical cord is lined by the smooth muscles. It helps to prevent the hemorrhage through the umbilical cord, especially after the delivery of the baby. When you are cutting the umbilical cord, the smooth muscles will get contracted immediately, and it will get closed off, and it prevents the damage, and it is not having nerve supply. And the attachment of the umbilical cord to the placenta is eccentric attachment, that is, it is attached to the center of the placenta, that is known as eccentric attachment. And even other forms of attachment are also there, that is central. Instead of the central, it may be a marginal attachment, that is, it may get attached to the margin of the placenta, or sometimes it may be a velamentous insertion, that is, velamentous means it will be, instead of getting attached to the placenta, it will be attached to the fetal membranes. See, this already I have discussed in the abnormalities of the placenta. That video you can see for this abnormalities. So that's all about the umbilical cord. So far we have seen amnion, that is fetal membrane, amniotic cavity, functions of amniotic fluid, contents and importance of amniotic fluid, and about the umbilical cord. So thank you for watching this video. We'll be meeting soon with a new video. Till that, bye.